Hello and welcome to another episode of Clean Talk. I'm your host, Brad Whitchurch. Today is November 16th, Wednesday, 3 p.m. Eastern Time, and that means we are coming to you live from the Seal Shield Studios in beautiful downtown Orlando, Florida. Very excited to have our guest today. Heather Hutson is founder and CEO of PreventionID. Heather, welcome to Clean Talk.
Thank you. Thanks for having me. I'm glad to be here.
Well, it's great to have you on the show, Heather. What can you tell us about yourself and why you're on Clean Talk here today?
So I am a board certified infection preventionist. I'm a registered nurse, CEO of PreventionID. But my background has been in long-term care for about 15 years. And that is where my passion is, infection control and long-term care. It's been a process to get here. I started in a long-term care facility as an LPN charge nurse right out of nursing school, worked all the shifts. I think that's what everyone does in long-term care. You just find your place and help out where you can. And then eventually went back to school, got my RN degree. While I was doing that, I still worked at the same long-term care facility as filling in on the weekends and different things like that. But my next step was nursing services coordinator. So I really managed a lot of the QA processes and focused on building the census. And then after that, I was promoted to the director of nursing. And I maintained that position for about 7 years. And then went on to another company that I helped start and was the chief infection prevention officer there. Unfortunately, that business is no longer a business. And I didn't want to stop helping long-term care facilities. So I started PreventionID, and that's where I am today.
Well, I know we're going to dive into it, but obviously infections in long-term care facilities, a significant threat and a real issue that I think we can make some progress on. I look forward to talking to you about that. Tell us about how you went from being an infection preventionist to becoming an entrepreneur, if you will, if you're okay with that term. What led you down that path?
I kind of a funny story. I set a goal years ago. I was about 14 or 15. That my goal was to help geriatric patients. I started helping a neighbor do house chores and things like that. So that really stemmed my pursuit of going into nursing school. And then when I was in nursing school, it's a funny story, and I'm sure a lot of people out there who are listening probably have experiences as well. But I was asked by a very seasoned nurse what my plans were, and I very proudly told her I was going to go into geriatrics. And there was silence following that. And she said, "Why in the world would you want to do that?" So from that point on, I made my mind up that my long-term huge goal was to help reduce the stigma around long-term care facilities and the industry in general. So it's a big goal, but I'm trying.
Well, I love that. A passion for helping people, specifically helping the elderly, seeing an opportunity, seeing a need, and driving yourself in that direction. And the result is PreventionID. What can you tell us about PreventionID and your mission?
Yes, absolutely. So PreventionID, our overall mission in a nutshell is to provide tools and resources to long-term care facilities so they can provide care to residents and improve the overall health and well-being to the residents because they deserve it.
Wonderful goal to be sure. And of course, there are a lot of holes in infection prevention, particularly in long-term care. What can you tell us about that? Where are some of the gaps that we're trying to address?
Well, absolutely. Number one at this moment is staffing. Staffing is, I think it's everywhere, but with long-term care facilities, it is such a huge issue because just because you're short-staffed, you still have to complete all the tasks that need to be completed. And what that results in is the staff that's there, they're overworked. And then, of course, when it comes to infection prevention, the infection prevention program ultimately becomes reactive and not proactive. And usually, what we see with that, whenever you have staffing shortages, you have a reactive program, it's not proactive, it's just not preventative. What it boils down to is facilities are controlling infections, but they're unable to prevent them due to lack of staffing and resources. And I would say that the second hole in long term care, whenever it relates to infection prevention and control, would be education. But more specifically than just education, is education that's not understood. I think that long term care facilities do a great job of checking off boxes whenever it comes to mandatory in services that are required. But I think that what we're not real good at is really making sure that the education that it's provided is provided in such a way that every department truly understands what's being delivered to them. So I would definitely say that that is the number two issue. And then number three, the third biggest thing that I see in long-term care is an infection preventionist that has multiple titles. I experienced this myself. I was the director of nursing / infection preventionist. And anytime that you see a nurse in a long-term care facility that has a slash in their name, you're just dividing their time between two very important titles. So what I found in myself was I did a really good job focusing on infection prevention when I had time, but that was about 20 hours a week. So the other 20 hours a week, I was focused on my duties as a director of nursing. So it just put me in this cycle of constantly trying to play catch up. And it goes back to what I said before, it turns into a very reactive program, and it's not proactive.
Well, and I think we've seen that across healthcare, particularly the staffing issues during COVID. And we talked about it before, but hospital-acquired infections are actually on the rise for the first time in a long time since the COVID pandemic. And I think it speaks a lot to the point you're making, that because of limited staffing, because you're spread so thin, you become reactive mode and things slip off the plate, right? And then education so important. And as you said, the education that people understanding. I recently found out that educate actually comes from the Latin word educo, which means to come from within, meaning that you're not educated just because you learned something and were told something. You have to understand it. It has to come from within. And certainly the staffing and having people well trained and well educated can make some major improvements, not just in long-term care, but in healthcare in general. Heather, we have some questions from our audience. Christian Davis asks, how does your organization financially recognize the cost associated with infections? So we talk about infections and reducing infection rates, but are you able to tie the cost into that? How do you look at that?
So when it comes to infections in long-term care, the long-term care facilities have so many regulations, they constantly change. And when a long-term care facility is deficient and they have failed practices related to infection control, any other deficiency, but just speaking on infection control, we see that facilities just recently in my state of Arkansas over the last 12 months have been fined these civil money penalties related to F880, the infection control citation, of up to $200,000 to $300,000. So absolutely, the cost is there. And that's why it's so important to stay on top of things and make sure that your program is proactive. And it has to be regardless of any of the other issues that I mentioned earlier.
And the penalties have to be there, right, in order for us to internalize those costs, because there are lots of hard to see and visible costs associated with hospital acquired infections. Just talking about acute care, the length of stay and readmissions and all these things that add into costs. And of course, that's magnified in long-term care.
Oh, yes, absolutely. It definitely is.
Well, Christian Davis actually has another question here. He's asking, what area of risk mitigation in your organization is your organization's primary focus post-pandemic. So I know we're going to talk about COVID. Maybe we should jump into that now. Obviously, a lot of things have changed as a result of the COVID pandemic. A lot of things in healthcare. We talked about the staffing. We talked about how hospital-acquired infections are on the rise. But how has COVID affected long-term care and what you're doing in your business?
COVID absolutely affected long-term care facilities, and we're seeing the result of that right now. Before COVID, I was the director of nursing at a long-term care facility. Right before COVID hit, that's when I transitioned to the chief infection prevention officer, and at the company that I was at before I started Prevention ID. And there were issues there, absolutely. But what we saw during COVID was facilities were not prepared. They they were prepared enough to address issues as they came, but they were not prepared to the point where they were prepared for, a major event like COVID. And what we see now is, just to be completely honest, and I think a lot of it, I sound like a broken record, a lot of it has to do with the staffing shortages, but that all goes back to they're tired. A lot of facilities, I'm sure that you remember hearing about long-term care facilities, that they locked the doors and employees couldn't leave. So you have to keep all that in mind. And, whenever we're looking at how things are now after COVID, I really feel like there's been a little bit of almost like they're kind of relaxing a little bit as far as their infection control measures goes. But it is never a good time to let your guard down. Even whenever the numbers in a facility drop, you still have to stay on top of things.
Well, I know that you're not necessarily an expert in the funding field, but it was well publicized that some federal money went into long-term care facilities for infection prevention during the COVID pandemic. Have you seen any benefit of that? Has any of that money shown itself in the activities that you're seeing on the front lines in long-term care?
So the facilities that I have worked with that I've spoken to about this funding, most of the fundings were to really push and drive staff retention. So a lot of the funds were utilized for that. A lot of other facilities use the funds to really stock their PPE, gloves, different resources like that. But overall, most of the funding went towards staffing.
Well, obviously, staffing has been a huge issue, and I'm going to take this opportunity to plug our friends at APIC, the Association for Professionals in Infection Control. It's apic.org. They have a comprehensive program designed to get more people into infection prevention because there is such a need for infection preventionists in healthcare. And so if you're interested in finding out more about being an infection preventionist, go to apic.org for more information to get on track. We can use more great people in the field. So talk to me about when you go into a facility, what is the process? So we know the holes for infection prevention. We know the challenges around the staffing. How does Prevention ID help?
So one thing that we stress at the very front end is that we're a partner. It's very important that we have that connection with the facility, that we're not coming in just to find their faults and walk away. We are a true partnership. So what that looks like is we always start with a thorough review of their policies and procedures. That's followed by an on-site visit, and it depends on how large the facility is. So we could be on site from anywhere to 3 to 5 days, sometimes a little bit longer. But what we do during this on-site visit is we do observations. It's also referred to as process surveillance of all departments and all shifts. I think a lot of times, I've seen consultants. I think consultants are great. So, but a lot of times we'll see consultants go into a facility and they'll mainly focus on the day shift. And the day shift usually has everything buttoned up. The leadership's there, the administrative staff is there. So we want to focus on all shifts in all departments, not just the nursing department. And since we already have a good understanding of their policies and procedures, we want to see if those policies and procedures are effective and if they're being followed. A lot of facilities that we have assisted have beautiful infection prevention a program, which basically consists of a binder that it has everything in it that is required of them per state regulations, but they don't really understand what's in it. They don't necessarily follow it completely, and it's not customized to their facility and their facility needs. So we do the process surveillance. We make sure that their policies that they have work for them. If they don't, then we make recommendations. Our recommendations don't have to be followed, but we're still going to make them if we see any failed practices. And then we take that information and then we take a very deep dive into their electronic health records. And this is called a compliance audit. We do this on a daily basis. Initially, we do a 6-month look back, and we're looking for everything. Of course, we're looking for any signs of a potential outbreak. We do tracking and trending. We maintain their infection control log. Basically, everything that is extremely important, but they don't have time to do on a daily basis, we maintain that for them. So it's, like I said before, it's a very proactive approach to maintaining their infection prevention program. A lot of infection preventionists will get pulled to the floor. So what we'll see is there'll be 2 or 3 days while they're working the floor to fill a vacancy where their program has fallen behind. So they have to play catch up. So we want to maintain that and provide consistency for the facility. After we have all the data, what we do is we assist them in completing a QAPI PIP. So a PIP is a performance improvement plan. Usually that we make the plan where it's 60 to 90 days. And at the end of this 60, 90 days, we have a goal and we have very detailed steps and measures to achieve that goal. But we still don't leave. We have visits, weekly calls. We provide guidance and mentorship, at least weekly calls, sometimes twice a week, to make sure that they're on track with that PIP. And if they're not, because things happen, we can customize it, extend the date out. We want to try to keep them as focused as possible and not have the PIP be something that kind of falls to the wayside. Additionally, if there is a change in leadership, if the infection preventionist leaves the facility, they hire someone new, we like to, like I said before, ensure that there's consistency. So making sure that that new IP that comes in really understands all the issues that that facility has had, where we are in the process of maintaining compliance, and they don't come in and have no idea where to start. So we help bridge that gap for them and provide the guidance and resources that they need there. So that's just a really broad overview. We have some very strategic partnerships with diagnostic laboratories. They provide PCR testing, not just COVID. Obviously, influenza, RSV, have really increased. They definitely have in our area. So providing education that's customized for every department. And whenever it comes to antibiotic stewardship, that's also a huge focus of ours, also reducing multi-drug resistant organisms. We provide education surrounding the PCR testing that really focuses on, like I said before, every department and making sure that they understand that their job is important in reducing the transmission of pathogens. And typically what that looks like is individual education per department. But really focusing on reduction of infections and antibiotics that are unnecessarily prescribed. And that really has a lot to do with ensuring that criteria is met prior to an antibiotic being prescribed, and catching those symptoms early, and not waiting until the resident has a high temp and needs to be sent to the ER, especially because this population is too fragile to wait. So that's it in a nutshell. There's a lot more little things that we do, but I could probably sit here and talk all day long about all of the value adds that we provide long-term care facilities.
Well, there's definitely a lot to unpack there. You mentioned the antimicrobial stewardship, and it has been suggested by some of the previous guests on this show that this is one of the key factors that's contributed to the rise in hospital-acquired infections during COVID. That during COVID, maybe we overprescribed antibiotics. You have lung infections, secondary infections. You've got critical situations. Throw antibiotics at it, and perhaps that has led to the uptick in the hospital-acquired infections. Obviously, staffing, one of the biggest issues, and I'd really like to get into, how you address with all the staffing issues out there, and with all the / infection preventionists out there. How do you address the entire culture of an organization? Because isn't it that what it takes, right? You've got / infection preventionists, you've got staff shortages. How do you get everybody on the same goal and culturally aligned to make infection prevention a priority? Is that something you think about?
Oh, yes, absolutely. That's something that I encountered as a director of nursing. What was very clear to me was that I had my responsibilities over the nursing department, but whenever I took on the / in my title as infection preventionist, I was now responsible for the whole program. And for an infection prevention control program to be effective, it touches every person inside and outside of the facility, and that's a whole nother topic. But things that go on in the community are equally as important as what goes on inside the facility. But as far as really ensuring that the culture changes is absolutely important. And what I did at my facility was, what I saw was every department kind of stuck to themselves. And we would have these meetings where the department heads would come together and we would share information, and then we would go on to our own departments. And in infection prevention, what I had to do was address every department separately, but also bring us all together. I had to make sure that they understood that their job was extremely important in reducing infections and preventing transmission of infections. And, once you get across to anyone how important their job is, that they're not just there to get a paycheck, but that they bring so much value to the overall health and well-being of every single resident that's in that facility. Once you actually get that employee to understand their value, they just feel empowered to do a better job. And that's absolutely what I did. And it was extremely effective. And I believe that. And I think that that's what it takes from a leadership perspective. You have to believe it before it's effective. So it starts at the top, and it's a trickle down effect from there.
And it takes a village. And
it does.
We've talked about the rise in hospital-acquired infections during COVID, but there are some rare examples where certain facilities have turned the tide on hospital-acquired infections during COVID. And I can tell you that the one constant that I see between those few facilities is a cultural approach that, just like you said, from the top down, everyone in the organization is involved in infection prevention. They take it seriously. how, and I know that that has worked for you, and so I'll set you up for this. I have a note that you were able to decrease the spread of pathogens in your facility by 75%.
Yes,
That seems like a dubious number there. How did you do that?
and that's really what really started my passion for spreading this knowledge to all facilities across the nation. Um, what I did was first notice that it was in 2019. I was the director of nursing, infection preventionist at a small long-term care facility in Central Arkansas, and I had probably 10 months to prepare our facility for the implementation of phase 3 regulations. What my focus was on was the infection preventionist role and responsibilities in antibiotic stewardship. So, got all my information together. We didn't have anyone that was primarily over infection prevention. We just focused on it when we had to. And what I noticed was we had a really high rate of infections that were being prescribed antibiotics for signs and symptoms. There was no actual diagnostic testing. A lot of those infections were respiratory. This is right before COVID, and a lot of that had to do with the fact that we were a very small town, and everyone had my personal cell phone. All the family members, they had our medical director's phone number, and a lot of times they would call and say, Mama needs a Z-Pack. She gets sick every year. She needs steroids and a Z-Pack, and then that'll fix her right up. And a lot of antibiotics were prescribed because that's what they needed. And what we found out by being proactive, implementing this, the PCR testing, which initially was actually very scary for me because I was in the mindset back then that I didn't want to know what I didn't know. And I've absolutely changed my mind now about it and my, how I look at things. But what we did was we started collecting PCR testing on anyone who had signs and symptoms of what we typically would have called a respiratory tract infection. And we noticed that most of the pathogens were viral and required no antibiotics. So then we had enough solid proof, if you will, to ensure the families that an antibiotic wasn't needed. Adverse side effects of prescribing antibiotics when they weren't needed would actually be, had the potential to be harsher on the resident.
And people don't want to hear that, right?
No,
Because
they don't.
for decades, this was the miracle pill, right? So all you got to do is take an antibiotic, and now people get frustrated. They come in, they say, "Give me an antibiotic," and you say it's viral. People don't want to hear that. Right?
Yeah, I had my fair share of upset family members, but I think that like I said before, whenever you present information to people where they can truly understand it, it goes a lot further than just saying, "Well, this is what we have to do."
Knowledge is
But
power, and being credible. So
yeah,
you're an expert in your field, and I'm sure that helps.
yes. So I couldn't just stop there. We had this great tool that we were utilizing. I needed to really understand why we had all these pathogens, sometimes up to 17 respiratory tract infections a month prior to implementing PCR testing. And so went back, oh gosh, probably a year's worth of data and sat down with a highlighter in my floor. And we weren't electronic at that time, so everything was very time consuming and manual, but I was very determined to find out where we had ultimately failed these residents. And what I found was we had lots of little clusters of these pathogens that were exactly the same, and dug a little deeper. Long story short, what I found out was we had so many holes in the policies and procedures related to the environmental department that we had one housekeeper that was very close to retirement, and we sat down and we talked, and she said, I'm just tired. And she wasn't cleaning the way that our policies and procedures were set up. And then whenever I really dug even deeper, they did not understand why. They had to pull a room, as what we called it, after someone was placed on isolation. When they came out of isolation, why they had to use all these special cleaning chemicals, and why we had to wait so long for the chemicals to dry to be effective. And that's when I realized, like, we had not done a good job of ensuring that everything was understood. So I, took all these policies and procedures, and department by department, did lots and lots of training and education, empowered all the staff. They understood that not only was their job important to the residents, but it also potentially had the effect or the potential to affect their families. If they didn't, follow things correctly, they could take things home to their families and or themselves. So I think that, once that was done, what we saw was the decrease of our infection rate and unnecessarily prescribed antibiotics. It was reduced over 9 months by 75%. And it was very constant. It wasn't something that I just did and walked away from and watched the results as they happened. I had to daily and constantly stay on top of it. But also, all the department heads at my facility had a responsibility for some part they had ownership of some part of the program. And, it was, sounds cheesy, but it was a beautiful thing that happened. And the results were absolutely the effect of the hard work that my staff put in to taking care of the resident.
Nothing cheesy about creating a culture around infection prevention. We're very passionate about that here
Yeah.
at Clean Talk, Heather. Heather, you talked about the environment, and by identifying holes in your environmental cleaning processes, you were able to reduce some viral load within the facility. We have a question from Derek Diaz. He asks, to what extent is UV disinfection being implemented in long-term care? Are there tools, techniques, technology that you're using to address the environment, and how big a part of that is UV in long-term care?
I've only seen a handful of facilities that have utilized any sort of lighting tools. My personal opinion is I think they're great. I feel like any tool that you could implement anywhere that could potentially affect and reduce any sort of pathogen, you should absolutely do it. But due to lack of resources and fundings and the financial situation of long-term care facilities, a lot of facilities are not implementing newer types of technology.
Well, that's unfortunate. Hopefully, some of that funding makes it to the technology that can help make safer environments in our long-term care facilities. I guess, we've talked a little bit now. I think I can predict your answer, but with all your experience in long-term care facilities and infection prevention, I know there's no silver bullet in infection prevention, but if you could wave a magic wand, what would be the one thing that you would change that could have the greatest impact in long-term care from an infection prevention standpoint?
If you could hand me a magic wand right now, I would wave it around and I would make all the staffing issues completely disappear in long-term care.
I thought you'd say that.
Yes.
I thought you'd say that.
It's always been an issue, but after COVID, we just really saw the numbers spike with, staff turnover and shortages. And no, there's not a large amount of people who are passionate and really want to go into long-term care facilities. So I would definitely take a magic wand if you had it right now, and that's what I would use it for.
Well, that's a great answer. And Heather, we appreciate all the great work you're doing over there at Prevention ID. What can we expect from Prevention ID in the future?
Well, we have a lot of really big goals. We definitely want to make a big lasting impact in the long-term care industry. Our slogan is the gold standard, and I feel like all the tools that we have to provide long-term care facilities with and the resources, we have, we're the gold standard in infection prevention and control. But eventually, we want to also make a lasting impact in schools and other types of businesses and industries. So we have big goals, and I don't really see us stopping until we reach those goals.
Meaningful, measurable impacts in infection prevention, not just in long-term care, but in the community in general. Any predictions for infection prevention moving forward as we're evolving from this COVID pandemic world?
Yeah, it's my personal opinion of that, and my prediction is that COVID was just a sneak peek of what's to come. I really don't think that anyone is in a position where they should be comfortable enough to let their guard down. I think that there is, with the increase, like you said, of multi-drug resistant organisms, we've seen some multi-drug resistant organisms, even in long-term care facilities that have never been there before. It's definitely not a time to let your guard down. I think that everybody should be prepared and should focus on what they can do next to prepare themselves even to the next point of what they're not prepared for.
I would like to think that we learned some things from COVID, and I know we did. I'm just hoping we learned enough to prepare us for the next inevitable pandemic. History tells us that humanity has very short memories about these pandemics. So hopefully you and I can keep it front and center and continue to make strides in this area. Our guest today is Heather Hutson. The company is PreventionID. Heather, if people want to find out more, where should they go?
They can absolutely go to my LinkedIn page or shoot me an email at heather@preventionid.com.
Fantastic. Well, Heather, we've loved having you on Clean Talk today. Keep up the good fight. Our guest today has been Heather Hutson. The company is PreventionID. And be sure to join us next Wednesday at 3 p.m. Eastern Time and every Wednesday at 3 p.m. Eastern Time for Clean Talk Live. Until next time, I'm your host, Brad Whitchurch, reminding you to keep it clean.